So now going down, so and then, okay, so you're suctioning saliva, all right. So now the physician, I'm gonna be your instructor, and I'll say, okay, physician, ask for some saline to clear a little bit of the airways.
I need some saline to clear some of the airways.
So now you're gonna grab your...
How much there?
20?
20?
No, just say 5 milliliters.
5 milliliters?
Your airway. Now, what are you gonna have to do? Whoa, where all that suction? There you go.
Just kidding. I was testing you guys.
I know, you did good. We all freaked out. Okay, now let go of your suction. There he goes. Okay, so clearing the airway, clearing the airway. All right. So now the physician is in the right middle lobe and seeing the consolidation, ready to obtain a sample.
Sample? Mm-hmm.
Okay, so now kind of keep that up a little bit there. So now he's going to say, all right, so let me get some, okay, we've got a little bit here, it's real thick, yellowish. Physician would like to have some saline, go ahead, and he's ordered 10 milliliters of saline. Kink it. So if you notice that you forget to kink it during the midterm, just say, wait a minute, I'm going to go back, give the 10 milliliters, I got to kink the suction. So then you're not messing up. You see what I mean?
Yeah.
So now he's suctioning, okay? Physician asks you, what do we have? So tell him.
We got good secretions.
Some real thick yellowish.
Some nice thick yellow secretions.
Good. All right, so do we have a good sample?
Yeah, it's full.
All right, good.
10 to 15? Yeah. 10 to 5, 15.
Okay, so now what are you going to do? And the physician says, go ahead and disconnect the Lucans. And you can leave it attached there. You're closed off now, and you're not going to lose your sample. Connect your suction back up. Okay, physician's going to go ahead and finish clearing out that area. As he pulls out, he's going to take a look into the left side and make sure that it looks good.
What was he doing, the lavage?
If we needed to. Okay, so,
I'm talking about.
yeah, then in the midterm. Okay, everything looks good. Procedure is done. Okay, so now you're going to, RT, take the scope, right? Disconnect the suction. Disconnect your Lucans trap. Set it over here.
I don't know where to put it.
Is he gonna drink it? No.
No, we're gonna put it in my pocket, right?
Okay, take your scope. You gotta, you gotta clean it out. So now you have your extra container, it'll be like a bigger bowl really, with saline in it. So now you're gonna suction up all that leftover saline because you're clearing out the mucus that's in the scope before we actually send it off to Central Supply to clean. Okay? Oh yeah, you gotta leave that on, sorry.
That's okay.
They're super expensive.
Yeah, these
You wanna
scopes are
make sure
super.
You clean them out good.
Yeah. And there's a high source of bacteria, which we recently had a big recall on some of the scopes. So now, physician, before you leave, will you turn the light off for me? Did you ever have the light on?
Yes. We tested it.
Oh, you
but
already
then
turned it
it's
off?
The green light.
There you go, okay. So
Never
now
had
it's
the
off.
light.
You didn't have the light on when you were going down.
Come on, Doc.
Doctor failed.
What are you talking about? I'm referring to your That was your job.
That physician didn't know what he was
These
doing.
new doctors, they don't know anything.
Okay, so now you're gonna go ahead and put that back on,
Young
and then
sir.
we would disconnect it, red bag it, and send it to Central. So you don't, yeah, you can just say, okay, I'll send that down and get sterilized. So now, you need to take your patient off their,
The normal.
Normal.
Put it back to normal.
put them back to their previous setting, and then you're going to reassess heart rate, blood pressure, breath sounds, pulse oximetry, patient's comfort level, right? Then after that, you gotta tell us, okay, I've got this labeled with the patient label. I'm going to write on here, RML, right middle lobe, the date, the time, and my initial. I'll put it in a biohazard bag that also has the patient's label on it, and send it to lab. So that's what you'll tell us, okay? And then in real life, we're gonna document how much saline we gave, how the patient tolerated, we document everything. we gave the lidocaine treatment, all of that, okay? But just do the procedure, set everything up, do the procedure, assess the patient after, label your sputum sample, and send it to lab. That's your midterm, okay?